Mixed reaction rolling in one day after Governor Phil Scott signed an executive order on health care. While the governor says it'll bring down costs by expanding insurance options, some Democrats argue it won't offer immediate relief and isn't the best path forward. ABC 22's Matt Holderman heard from both sides today, and he joins me now live in the studio.
Thanks, Lauren. Yeah, this is certainly one of those issues where both sides agree that there is a problem. They just can't agree on how to solve it. Many Democrats are still standing by the health care bill that Governor Scott vetoed, but Republicans back his plan and are hoping they can win more seats in November to help push it through.
Over the last 10 years, I've talked a lot about how important it is to address the affordability crisis. And today's executive order is just about beginning to change that.
Governor Phil Scott taking action on health care Wednesday afternoon, signing an executive order largely aimed at bringing more health insurance companies into the state to increase competition and, in turn, bring down costs. The order puts the first phases of that plan into motion, and the other pieces will be up to the state legislature in 2027.
And we know they'll work because we've seen how these practical reforms have helped other states expand affordable choices. Right next door in New Hampshire, they're eating our lunch.
This comes less than 1 month after the governor vetoed a bill aimed at lowering health insurance costs in a different way, largely through controlling what hospitals are allowed to charge. State Senator Ginny Lyons, who led that bill and chairs the Senate Health and Welfare Committee, says that while the governor addressing health care is good, she still stands by her plan over his, arguing hers would have brought down prices right away, while Scott's is a years-long process.
And the work that we did with S-190 does offer some instant relief. I think it's really unfortunate that the governor has made this a choice between what he has proposed and the work that's been going on now for, 5 or 7 years.
Whichever plan ultimately prevails could come down to what voters decide at the ballot box this November. Even with the veto, Democrats plan to continue working on parts of Lyons' proposal next year. But Republicans say if they're able to gain control by flipping either the House or Senate red, they can get the governor's work back to his desk.
I think this is a good first step to try to move towards a system that has some competition in it. Elections matter, and we'll see what happens in November.
And just to remind everyone of those current splits, Republicans have a more realistic chance of gaining control of the Vermont Senate than they do the House. The Senate currently consists of 17 Democrats or progressives and 13 Republicans, while Democrats still outweigh Republicans by more than 30 seats over in the House. Reporting live in the studio, Matt Holderman, ABC 22 News.